Good morning, everyone. This is Deanna Mitchell with Leading Age Michigan, and we have set up this webinar this morning to provide an overview of association activities that we put together to assist our members with navigating through this current situation with the coronavirus. When I wrote this PowerPoint for this webinar, it was not officially called a pandemic yet, so I've not updated that, but it's obvious that yesterday the World Health Organization labeled this a pandemic, and that, of course, is a major action. Everyone's going to be in listen mode this morning. We're going to use chat for questions and comments, but for future webinars that I'll talk about a little bit later, we're going to have open lines for discussion because we think that's an important piece too. But this morning, what we want to really focus on is what we're doing going forward, and some of our communications and messaging and resource materials, and how we're going to try and disseminate all that to our members. So we've called this Safe and Calm because we want to make sure that we don't panic, but at the same time, we intentionally do those things that we have to do in order to safeguard our residents and our staff. So we've created a website that's intended to help focus all of our members on the current and most relevant resources. So we want to provide access to those materials on a daily basis, and staff here will be reviewing and updating those materials every single day with a view to update materials that have been changed, and that has happened from CMS already, that they have updated some of their guidances, and to kind of move the focus away from unrelated materials or duplicated materials, because we're all inundated with everything about the coronavirus at this point. We also are using our website to keep our members updated on a daily basis about where the cases are and what the current spread is. And we'll talk about that a little bit more. We will do that on a daily basis. We have not done it yet today. We will be updating probably every afternoon, since the department updates the Michigan numbers at noon every day. But the federal agencies update their numbers. The CDC updates its numbers in the evening the night before. So we will probably be doing updates every afternoon. One of the things that we think is most important is that understanding that our members are going to be inundated with messages, ideas, regulations, updates. The real challenge is how our members are going to operationalize those things. And so one of the ideas with our program here is to provide a forum so that members can come together on a weekly basis, identify challenges, identify maybe ways to get around some of those problems with some perhaps innovative solutions. Standardized care as much as possible, creating care models that based on standards, if you can do it in this environment, is important for any future legal issues going down the road. And last but of course not least, we want to get from our members ideas about what their needs are in order to inform our advocacy here in Lansing. We have been in a lot of communication with both the Department of Health and Human Services here and Laura. So I felt the need, I guess, to provide a brief overview, but I don't really think that we need, at this point, an overview of what COVID-19 is. I do want to point to the graphic, though. This is the CDC Graphic that is a free graphic that they allow everyone to use and share. Just because you see this graphic does not mean that it's a CDC document or program or whatever. Everyone is using this graphic. So it could be a CDC sanctioned document, but it might not be. So you're going to see this graphic everywhere. You'll note that this graph shows the level of testing. It has not been updated since 3/8. This is the level of testing across the United States, and we're doing better with testing, but obviously testing has been a real challenge. But it does show that the U.S. public health labs, and that would be your local health departments, et cetera, have sort of taken over the testing for this viral infection. And we're hoping to see more testing as we move forward, but we know that availability, and in Michigan especially, availability is still very, very limited. So on March 5th, we received notice that there were 300 test kits that arrived. I think that they've actually used more than 300 in the state to date. And even though we get messages from the federal government that anyone who requests a test should get a test, that really isn't still true yet. Basically, you have to be in close contact with a confirmed patient or a history of travel with some symptoms. So testing is still very, very limited. I'm hoping that there are funds coming apparently in the near future. I'm hoping they can open up that testing a little bit better. They are working on a system that can process a huge number of tests, but we've yet still to see that happen in Michigan. Part of the dilemma with the testing is that the limitations on testing means that we really don't know who's been infected. So our numbers right now are really low compared to some other states, but it doesn't mean that there isn't a lot of infection out there already. And so although we certainly want testing to be available and we want to work on that, we can't assume that because we have a few confirmed cases that that's really the reality here in Michigan. So this is the graph, actually it's a table that we put on our website every day. And it has not been updated yet for yesterday's data. And you'll see that these are Michigan numbers, that the number is rising for referral. We have 2 confirmed cases at this time, both in Wayne, one in Wayne and one in Oakland County. But we also have 2 cases pending, according to the news media this morning, one in Ingham and one in Clinton. So this is something that we will track every day, and we will have on our website every afternoon as a single source place that you can go and see where the virus is spreading. So on that same website, we are also reporting the national trends. And this is, I think, an important piece. I mean, you'll see across the last couple of days that we've gone from 34 to 38 states plus the district in terms of where the infection is. But we've gone from 423 cases to 938 cases in 2 days. And that's significant. Remembering that, number one, there's a lot of unreported cases, and number two, there's an estimate that each confirmed case could spread this illness to 2 to 3 other persons. So we're going to expect exponential numbers of cases in the next few weeks. So even though we're going to focus very, very hard on trying to get the most pertinent and most relevant materials up front to you, we do want to remind everyone that there are 3 major places that you can go, and Leading Age Michigan is at the bottom there. That's where our website page is. But do check the CDC site itself and the Michigan-specific site itself now and then to get more general and background updates. These are the 3 sites that are most important. Of course, CMS will put out their regulatory guidances via email. This PowerPoint will be sent to everybody after the webinar, and these links are live, so you can just link on them from here as well, attach them from here. So again, we've started a website. The address for that is at the bottom of this page. We will update the statistics every day, and then we will also update that front page under recent updates is the title of this section. And that will include new resource materials that we think are most helpful and most pertinent to members. We will rotate those, so we will archive the old ones and store them somewhere else under a different link. But you can anticipate that anything that comes out new today will be on that recent update list if it's pertinent and not duplicative each afternoon. We have identified additional resource pages at the bottom of this landing page that we've developed. And right now we have organized them by where the information has come from, because as we started, we had just a few pieces of materials. We're going to be kind of morphing this section into topical areas such as clinical care, communications, regulatory issues, etc. We're going to be working on that in the next couple of days as we move forward. But if anybody cannot find something that they need to find, they can always give us a call, and I have a website address. Not a website, I'm sorry, an email address for that as well that I'll talk about in a minute. So the most pertinent materials that are on that website right now include the next two slides. One of the most important ones, I think, is preparing for COVID-19 in your program or community. One of the challenges that we have, as we have with almost all of our education and training and information, is that there's so much more out there for SNFs than there is for other levels of care. And one of the good things about a couple of these documents is that they provide guidelines for all levels of care, including home care, home health care, adult day health, assisted living, senior housing, etc. So we've tried to include and have really sought out educational materials that will help those provider types as well. The first document was written when there were no cases in Michigan. It has screening criteria, etc. Every member provider is going to have to think through whether or not they want to limit, severely limit movement in and out of each facility at this point. Now that we have cases in Michigan, and now that President Trump has declared a national emergency, there is a case for being a little bit more limiting in how you allow visitors and other persons to move in and out. But here are some of the, I think, more important pieces that will help providers identify what their next steps should be, and also kind of review of some of the current regulatory issues that are out there. The CMS survey letters, they're all on one page, and we have included not only the survey letters for nursing homes, but we included those for hospitals, hospice, and CLIA. We know some of our members have CLIA facilities. So we want to make sure that you have access to materials that tells you how other provider types are intended to react to the coronavirus as well. The pertinent materials as is yesterday, and I think that these were all kind of important. The CDC put out a framework for mitigation. And again, that is a document that speaks to every level of senior care provider. So I think that's a very important piece. And when you get these slides, you'll note that there is a direct link from here to there. They also put out yesterday a home health worker guidance for COVID-19. And lastly, yesterday, they put out a CDC guidance on masks. Now, this last guidance is extremely controversial because what pretty much everyone said was that surveyors are not required, just for now, to ensure that healthcare workers must use N95 masks. They can use other NIOSH masks if needed, because they're pretty good. And nurses in California are reacting very negatively to this because they have a lot of cases there, and their feeling is that now they can't hardly get an N95 mask, and they think that they're not being protected well enough. So I'm not sure if this guidance will stand, but for right now, N95 masks, they don't have to be tested the way they normally are. And healthcare workers are now allowed to use other respirators that are approved by NIOSH. So some screening and testing reminders. We have several screening guidelines available on the site from both federal and state sources, and they can be used for almost any provider type. You know, going in and out of assisted living is not any different than the risk for going in and out of the nursing home, except your consumers might be more vulnerable. So it's also important to remember considerations about screening all business partners and staff daily. We have heard some chatter about some of business partners not wanting to be screened, and that's something that you're going to have to look at in each of your communities. There is a document that MD-HHS had put out called Healthcare Professionals Guide to Disease Reporting in Michigan. It is a very long and complicated document, but if you need a review of your reporting requirements, pretty much pages 1 to 4 might be useful there. So just as a possible review, if you need to have that. And remember that all potential cases are confirmed by the CDC. This is not something that you're just going to, the local health department is going to identify as a confirmed case. They will identify a pending case, but not a confirmed case. So member reporting. Leading Age Michigan has been talking to the state, and there is an identified person in charge for coronavirus communications. And what they're asking of us is that not only do they want our members to report to the normal, through the normal reporting mechanisms, they want them to report to us any staff illness or resident illness that looks like suspected COVID-19 or confirmed COVID-19, and we are using this email address to do that. I think that the idea is they want to be aware of any cases and, or potential cases immediately. They don't want it to have to shift up through the whole reporting mechanism before they're aware of it. So we have told them we would do that, and we're going to ask our members to report any potential cases. I mean, certainly no personal health information, but just the facility, etc., through safe and calm at leadingagemi.org. So as with all mandatory reporting, you have to make sure that you communicate any suspected cases within 24 hours to the local health department. I would actually do it closer than 24 hours if I were you, or the Michigan Disease Surveillance System, and they will contact MD-HHS, and they will also contact LORA eventually. And then the local health department will provide direction and complete testing. You do not have to directly report anything to LARA if you simply have a case. The only thing you have to directly report to LARA are any allegations of neglect, if they're related to the coronavirus or related to anything really. So there is no direct reporting mechanism to LARA for this. So starting next Wednesday, we are setting up a weekly forum, and each of those forums will have a standard agenda. We will talk about our current situation in terms of outbreaks, where those outbreaks might be, any state or local health department restrictions related to those outbreaks, any important resource updates since the last time we gathered together. And what we really want to focus on is member concerns, challenges, sharing of information, individual community experiences, any best practices. And we want to also hear from you about what's really helping you, what's not helping you, so that as we try to provide assistance going forward, we can make sure that we're being most helpful. So in the last 24 hours, President Trump declared a national emergency yesterday, and that's an important action because it means the administration can more easily waive certain requirements. They could waive requirements for skilled nursing coverage, They could waive requirements for practitioners who are not licensed in the state but want to come and help. We will update all of those CMS changes daily as some of the regulatory pieces are bound to change moving forward. As of yesterday, the CDC is sending $14.6 million to our Michigan health departments, and the state is looking at another $25 million in funding to assist in dealing with the coronavirus. I think $10 million is for the state departments, and they're putting $15 million aside for issues as they arise coming down the road. The joint provider training has been canceled at this point. I think you're going to find that a lot of the larger group meetings are going to be canceled. One information piece that I learned this morning is that the state of Washington secured $50 million to assist SNFs to deal with unexpected costs, mostly to be used for staffing and protective equipment. And they allotted about $120 million for all programs, because there's a big concern that hourly employees who may become ill won't stay home because they can't afford to stay home. So the state of Washington, where a lot of this, the infection really started, and in nursing homes there, have secured some additional funding, and so we'll be talking to the state about that as well. We're also talking with the state about allowing some of our skilled nursing facilities with excess capacity. In other words, facilities that have offline beds to maybe put them back in service in case some overflow might be needed. And we do have some media talking points listed on our website. We'll be adding to those as issues evolve. One thing that I want to remind everybody of is that the compliance store has tools and guidelines that might help. And through, I don't know if it's through May, but until May, assisted living facilities have full access to the compliance store free of charge. So if you don't know how to do that in your assisted living facility and you are looking for some educational infection control materials specific to COVID-19, they have specific COVID-19 materials as well. Shoot us an email on Safe and Calm email address, and we will assist. SNF rates for the compliance store continue to be discounted. And remember that you can take those documents, relabel them, and use them as your own. So again, we have created a specific email address for member questions, comment, and discussion. That's safeandcalm@leadingagemi.org. Our internal work group will use this communication to identify member concerns, challenges, inform our work going forward. We want to advocate for your needs and your resident needs, and we want to help disseminate those best practices. So, contacts. Laura Funch and I are working together to cover and address the COVID-19 issues for Leading Age Michigan members. Our email addresses are right here, and again, the Safe and Calm @leadingagemi.org address is here for any general questions that we can help you with. So I don't see any questions or comments on chat. I want to, before we end for the day, I want to wait a moment and see if there's anything else that you all want to talk about today. Again, our next step will be to keep our website updated between now and next Wednesday, and then we will have a discussion forum next Wednesday that will allow us to talk about what's going on in your facilities and what you're challenged by, and maybe share some ideas about that. So I'm going to finally stop talking and give you a moment. If you have questions or issues, please let us know now.
I did just have a question come in, Deanna. Do you have a sense for what the recommendations are for having staff stay home? What symptoms make them stay home? Does it have to be positive for COVID?
No, it does not have to be positive for COVID-19. Anybody with a temperature, respiratory symptoms, anything that looks like they might be contagious should stay at home. And I will pull up the criteria for that in a couple documents that we have and put them on our recent updates. Because there's a 14-day incubation period, you really don't know if somebody has the sniffles. They could have COVID-19. They could have had it, unfortunately, for a couple days before then. But as soon as you identify someone with symptoms, what you might do is monitor them. But if someone has symptoms, they should stay home.
All right. Dana followed up with that question and said if they only have a cough as well.
Well, I think that you might need to use your clinical judgment here, and maybe your medical staff to determine that. Let me give you an example. I have a cough a lot of times because I have asthma, but it does not mean I have a virus or that I have any infectious at all. So I think that in those cases, you need to look at each one by one and determine what the best course is for that person. And if, of course, if they do have something that could be contagious, you need to make sure that they are masked and using protective equipment appropriately. But each community is going to have to kind of grapple with that themselves. But if you think someone is sick and infectious, they should stay home.
All right. I can answer this question. Can we get a copy of this PowerPoint? Yes, we will be sending it out after this webinar has concluded. I believe I'll probably just have to send over the attendee list to Deanna, and I'm sure she can send that out to everyone. I do have another question. What are your thoughts regarding restricting residents from going LOA?
I believe that right now all residents would be considered highly vulnerable. I'm not sure that there's any requirement that you stop people from going LOA, but I certainly wouldn't encourage it. Because if they move into the public arena and then come back into your facility, they could not only put themselves at risk, but put the rest of the facility at risk. I believe that President Trump yesterday, during his Oval Office address, suggested that all movement in and out of nursing homes be limited to medical necessity. And at this point, that's something that I would consider if I were a community. Anything else?
As of right now, I do not see any more questions. We can go ahead and wait. Never mind, just had one come through. What is your recommendation based on the most current CMS memo on restricting visitors and visiting hours?
Okay, first of all, I do have to put this out there that I am not an infection control expert. What we're doing is we are working through and reading all of the documents and making sure that you have the best resources. I think that considering that it feels like we are on the edge of a major outbreak, even in Michigan, that I would utilize all of the CMS recommendations strictly if it were me. Because nursing homes are pretty much the center of the highest risk for our residents, I would take the highest level precautions that are necessary. I know not to panic, but definitely to be very careful here. One of the dilemmas is that some experts are telling us that a lot of people are going to get this virus. Most of them are not going to become ill at all, but our residents are likely to become very ill and perhaps mortally so. And that's a huge issue as we move forward. The thing is, though, is that if we don't contain the virus to some degree, or mitigate it at least, we are going to overwhelm the healthcare system. So some experts are saying, you know, it's almost known that it's going to spread throughout the United States. But the trick is you have to delay it as long as possible, or you're going to overwhelm the healthcare system, and the healthcare system is going to shut down, not be able to take care of patients of any with any kind of clinical condition because they're going to be so overwhelmed. So mitigating risk, I think, has to be one of our highest objectives at this point.
Okay. Do you know if there will be federal funding coming in for the state of Michigan, and if it will be allowable for staffing overtime expenses?
Right now, that's not clear. There is some money coming in for mostly, I think, state, local public health agencies. I do believe, if my understanding is correct, that Congress right now is looking at some ways to assist. I don't know if, I do think that staffing, I don't know if overtime was listed, but some assistance to some providers was an idea. But there is nothing that I'm aware of currently that Congress has passed. They're looking at ways to mitigate the economics of this, ways to ensure that people have enough sick time, and some of the issues like that. But nothing, to my knowledge, as of this morning, has been determined.
So would you recommend screening all visitors and staff, or stopping all non-essential visits completely?
At a minimum, and this was our recommendation earlier in the week, you have to screen staff and residents, visitors and business partners every day. I think that that's a basic idea. I think that I don't feel comfortable recommending anything higher than that based on the fact that I'm not an infection control expert. However, I would think at this point it's not a bad idea to limit the number of people moving in and out of your facilities, and I would certainly be working on that. And I wouldn't be surprised if you didn't hear from local health departments or the state in the near future if the numbers continue to go up, mandating that. But we'll have to see how that goes forward. I think it would be proactive to put some limitations on that now. However, there are no rules about that, and it's really kind of hard to see the future. I guess that has to be an individual community decision at this point. I personally would err on the side of caution.
Any recommendations for assisted living and independent living facilities the same as nursing homes?
I think in terms of screening and limiting visitors, I would see no difference.
All right. It looks like maybe at some point Laura Funch's email had been addressed, and it may have been said incorrect. So if you do need to reach out to Laura Funch, her email is lfunch, and that is spelled LFUNSCH@leadingagemi.org. In case you need to reach out to her for anything. And then Deanna's email is just Deanna, DEANNA @leadingagemi.org. Right now, I'm not seeing any more questions, but we can, again, wait a second if anyone has anything. And if not, we will be good.
Okay, well, thank you very much, everybody. I think our goal is to all work together so that we can all get through this together. And please feel free to email me, Laura, and I apologize, I screwed up her address, or Safe and Calm email address, and we will certainly try our darndest to help you. We are working on this every day. So good luck, and we will be talking to you soon. Have a good day.
All right, and yes, thank you, everyone. We did have 46 attendees on this call, so just wanted to thank everyone for joining us, and make sure to look out and join the upcoming calls as well. Everyone have a great Thursday. Thank you.